Everyone. Today we're going to talk about bronchial tree anatomy. Now, if you see the respiratory system consists of, it starts from your nose, okay? From there you inhale the air or from there you exhale the air. But at the same time, when it goes down, it passes through many passages. Now, those passages are important part of your respiratory system because there are certain passage which is working for conducting the air, and there are certain passage which is working for exchange, gas exchange. So all those things are going to come in the heading of anatomy of the bronchial tree. And as a physiotherapist, we need to deal with many patients who are having issues with the bronchial tree. Okay, so either they have a problem in the area where there is a passage of air is happening, or else they have a problem in those areas where the gas exchange is happening, or both. So that's why, as a physiotherapist, we need to know about what is the normal anatomy of the bronchial tree. So that we are going to talk about. Okay, so welcome to my channel. We are going to start with the today's topic, that is anatomy of the bronchial tree. So now, if you see this, what is happening over here? So here we are seeing two pictures are there. Okay, uh, today's topic is all about a picture because it's very easy one. Yet it is very important, but it's very easy topic. So as we see over here, it starts from the trachea. Okay, so you have your nasal cavity, then you have pharynx, larynx, and all those structures are there. That is your upper respiratory airway. Then it comes over the trachea. So from trachea, your actual bronchial tree starts. The trachea, then it is divided into two parts, that is primary bronchi, so right main primary bronchi and left main primary bronchi. And that way, these are the main two branches of your conducting airway. This is called as conducting airway because it is allowing the air to pass. Okay, these are made up of cartilage tissue, cartilaginous plates. From here, okay, from this primary bronchi, this is going to divide on right side into three second. Okay, so this is your trachea. Then you have primary bronchi on each side, right side and left side. Where it is getting divided, that portion, this portion is called as carina, C-A-R-I-N-A, carina. That is a bifurcation of trachea. Okay, carina is a bifurcation of trachea where this trachea is divided into right and left side. So when it is divided, the right primary bronchi and left primary bronchi, the right primary bronchi, it is like around 2.5 centimeter long, shorter, wider, and it is more in line with the trachea. It is quite straight. The right one, the right primary bronchi is quite straight compared to the left one. If you can see over here, the left one is taking a bit angle. That angle is around 45 degrees, while the right main primary bronchi is only taking 25 degree of angle. That is why this is very important thing we need to understand, that any kind of foreign particle, when we are inhaling, by mistake, if we are inhaling any kind of foreign particle, that foreign particle is very easily, it can go into the right lung because the passage for the right primary, main primary bronchi, it's quite straight in context with the trachea, while the left one is taking turn over here of 45 degree because there is a heart present over here. So that's why it is quite less common that any kind of foreign particle getting dislodged into the left lung, but it is very commonly it is happening in the right lung. Even when a patient, अगर कोई patient ऐसा होता है where you require them to undergo intubation, if the patient is kept on mechanical ventilator, and if the intubation is happening, that intubation ideally need to end in the trachea. Okay, it should not reach up to the carina also. It should be in this area, in the trachea itself. But by mistake, if it is further going inside, it can enter into the right primary bronchi very easily because the passage of the right primary bronchi is quite straight along with the trachea. That's why. So here we see that you have two primary bronchi, right and left primary bronchi, but the right primary bronchi is shorter than, it is wider and more in line with the trachea, while the left one is 5 centimeter long. Okay, this one is 2.5. This one is 5 centimeter. Left one is 5 centimeter long. It is quite narrow, and it is taking a proper turn of 45 degree of angle. it is more in oblique shape, oblique line. So in that way, you have these two primary bronchi. After that, this primary bronchi, you will be having secondary bronchi. So secondary bronchi will be according to the lobes what you have. So as we know that on right side, we have three lobes. Okay, you have upper lobe, then you have middle lobe, and then you have lower lobe. So in that way, the right side, in the right lung, you have three secondary bronchi. You have one secondary bronchi for the upper lobe, one for the middle lobe, and one for the lower lobe. While on the other hand, in the left lobe, left lung, you have two lobes, upper and lower. So here, secondary bronchi will be divided into two parts, one for the upper lobe and one for the lower lobe. While on the right, it is divided into three parts. After that, this secondary bronchi will be further divided into tertiary bronchi. Okay, so we can see here these are the tertiary bronchi or tertiary bronchus. These tertiary bronchus will be on the basis of how many bronchopulmonary segments you have. So further, if you see the right lobe, okay, so to understand it easily, if I want to explain you that it's based on the, it's the example is like one house. If you take one house, how many number of rooms they have? Okay, in one house, for example, it is 5 rooms or 6 rooms or 10 rooms in that way. So we are taking 10 rooms. Okay, one house is there which is having a 10 rooms. So here, the right side, it has 10 bronchopulmonary segments. And according to each bronchopulmonary segment, that there will be tertiary bronchi. So there are 10 tertiary bronchi on right side and 10 tertiary bronchi on left side. So in that way, the division is happening. So when you have trachea, trachea is divided into primary bronchi. Primary bronchi is right on left side, then right side primary bronchi is divided into three secondary bronchi, and left side primary bronchi is divided into two secondary bronchi. Then each secondary bronchi will be further divided into your uh, tertiary bronchi. So you have 10 bronchopulmonary segment on right side and 10 on the left side. So accordingly, 10 tertiary bronchi on right side and 10 tertiary bronchi on left side. So in this way, your tertiary bronchi will be divided. After that, this tertiary bronchi will be further going into the segmented bronchi. Okay, so it is going to make segmented bronchi. Now, to understand that, we are moving on the next diagram. So we can see here there is a trachea. This is carina where it is divided bifurcated. After that, you have primary bronchi. Primary bronchi will be giving rise to the secondary bronchi. Secondary bronchi will be giving rise to the tertiary bronchi. The tertiary bronchi will be continued as smaller bronchi. This is your segmental bronchi, or else it is also called as the terminal bronchioles and respiratory bronchioles. So these are the terminal bronchioles and respiratory bronchioles. Then further it is divided into alveoli, that is pulmonary lobules or pulmonary sac. So it is a pulmonary unit which consists of alveolar duct, atria, air saccule, and pulmonary alveoli. So in that way, the whole generation of the respiratory system is happening. It starts from the trachea. Trachea is the first generation, up to the alveoli, which is the 23rd generation. So you have total 23 generation, where first generation to 16 generation, that is up to your, like if you see the trachea you have, then your primary bronchi, secondary bronchi, tertiary bronchi. Then you have the tertiary bronchi is also called as segmental bronchi because it is supplying the bronchopulmonary segment. After that, you have terminal bronchioles, respiratory bronchioles. Then you have pulmonary unit. Pulmonary unit consists of four components. In that, you have four components, so which are alveolar duct, atria, then air sacules, pulmonary alveoli. In that way, it is divided. So uh, that see in this diagram we can see those things. So now these are the generation what I was talking about. So first is trachea. Trachea is a zero generation. Then primary bronchi, right and left primary bronchi. Then secondary bronchi is on right side you have three and left side you have two. Then tertiary bronchi. So on right side and left side both are having 10 tertiary bronchi. Then it is giving rise to the terminal bronchioles, which is up to 14 generation. Then you have respiratory bronchioles, which is up to 16 generation. So up to 15 to 16 generation is known as conducting airway, which is not allowing gas exchange to happen. Conducting airway is made up of cartilaginous tissue, while from the 16 to 23 generation, it is your respiratory zone, which is made up of smooth muscle. So where the gas exchange is happening, where bronchoconstriction or bronchodilation happens, so all this function is done by smooth muscles. Okay, so and then after respiratory bronchial, you have alveolar duct and alveolar sac. So in that way, the whole of your respiratory system is taking place. So the same thing, like you can see, this is up to the 16th generation, and these are the 16 to 23rd generation is over here. We can see. So this is about your bronchial tree. Now, the next thing what we are going to talk about is bronchopulmonary segment. So we can see here the bronchopulmonary segment. So as we had discussed already that you have 10 segments on right side, 10 segments on left side. So now first, what is bronchopulmonary segment? So bronchopulmonary segment, like earlier when I still remember when I was in my first year, when I was like it, I was in my first year in 2002, 2003 year. I do remember that in the book which I was referring, it was showing that right side is having 10 bronchopulmonary segment and left side is having 8 bronchopulmonary segment. So in that way, certain books, they have a kind of different opinion, but generally we'll consider as 10 segments on each side. Right side is also 10 segments and left side is also having 10 segments. So bronchopulmonary segment, there are 10 segments present on both sides. Now, what is the definition? It's a well-defined anatomical, functional, and surgical sectors of the lung. So it's an anatomical structure. It's a functional structure. The gas exchange happens in each of the bronchopulmonary segment, each of the 10 on right side, 10 on the left side, both sides. In each bronchopulmonary segment, the gas exchange will be happening. So that's why it is called as functional unit. Then it is surgical sector also, because if one of the bronchopulmonary segment is having some abnormality, which is not taking part in gas exchange, and instead it is giving rise to infection, in that case, they will remove the whole segment. So they will go for the segmental section. So in that's why you even have to know about this each segment, that where they are present, what is the location, that all things we need to understand properly. Each one is aerated by a tertiary or segmental bronchi. As we had discussed it already, that you have uh, uh, the tertiary bronchi, it's also called a segmental bronchi. So each bronchopulmonary segment, it is made up of tertiary or segmental bronchi. Each segment is in pyramidal in shape. So that we'll see in the next slide that, okay, yeah, you can see here, it is kind of wedge shape or pyramidal shape, the shape of this. You can see the dotted line, it's of one segment, one bronchopulmonary segment. So it is of pyramid shape, and that pyramidal shape where the apex is directed towards the root of the lung. So root, or where the hilum is present, the apex is towards that root area, okay, where from where the hilum, from where the trachea is or primary bronchi is inserting into the both lungs, it's your root. The pyramid apex is towards the root area. Then each segment has a segmental bronchus, segmental artery, autonomic nerves, and lymphatic vessels. So they have their segmental bronchi, segmental bronchus. They have segmental artery. They have autonomic nervous system. They have lymphatic channel. Everything is there. Then the segmental venules also are present. The segmental venules, they are present in the connective tissue between the adjacent pulmonary unit of bronchopulmonary segment. So these are the two bronchopulmonary segment. Okay, so it is called an intersegmental plane. So the venules are present over here. Okay, the segmental venules are present over here on each side. And then during the segmental resection, the surgeon works along the segmental veins to isolate the particular segment. So that's again the part of the pulmonologist or pulmonary surgeon. So as we need to understand the bronchopulmonary segment, why it is important, because you have to deal with each of the segment. Suppose if you are getting a patient who is having pneumonia, this area, the bronchopulmonary segment, will be filled with the secretion. So as a physio, our role will be to clear the secretion from those particular segments. We need to understand that. एंड दैट इज you need to have एज अ फिजियो वी नीड टू हैव एन आइडिया, हमें आइडिया होना चाहिए कि वो हर एक ब्रोंकोपल्मोनरी सेगमेंट कहाँ पे होता है, किस तरह से उसका लोकेशन क्या है, उसके फंक्शन क्या है, ये सारी चीजें हमें पता होनी चाहिए. दैट्स व्हाई वी आर टॉकिंग अबाउट इट. So we had seen that your each segment are having the same kind of structure. They have one segment with bronchi, they have an artery, they have adjacent wall. It will be having a vein. They have lymphatic channel. They have autonomic nerve fiber present in each of the segment. So that is the thing. So here we can see that as I told you earlier, the right is having 10 lobes or 10 segments and left is having 10 segments. In that, the right lung, it has three lobes. The right upper lobe, it has three segments. You can see here one, two, and three. The one is apical segment, two is posterior segment, and three is anterior segment. So apical, posterior, and anterior segment, which is there in the upper lobe of the right lung. Then middle lobe, it is having two bronchopulmonary segment, medial and lateral. Okay, so this is your medial and lateral segment. Then lower lobe, it's quite bigger one, and which is major part of the lower lobe is on the posterior aspect. So it is having five bronchopulmonary segment. So it is your superior segment or apicobasal. It's also called superior basal or apicobasal or superior segment. Then your medial basal, this is medial basal, anterior basal, lateral basal, and 10 number is posterior basal. So you can see from this one, okay, same thing is over here. And on the left side, you have two lobes, the upper lobes and lower lobes. Upper lobe and lower lobe. In upper lobe, you find apical segment, then your anterior segment, posterior segment, lingular superior and lingular inferior. Here you don't have middle lobe, as we had seen in the lung topic, that you don't have middle lobe on the left side, but you have a thing called as lingula. So lingula is having two segments. It is lingula superior and lingula inferior. So it whole comprises of the upper lobe of the on the left side. Now the left lung, the lower lobe, it has same like the right side. You have a apicobasal segment or superior basal, yeah, superior segment. Then you have a basal segment, which is quite inner one. You can see over here, but on the medial wall it is present. So medial basal, then anterior basal. This is anterior basal, lateral basal, and posterior basal. So in that way, the left lung is having 10 bronchopulmonary segment, and right lung is having 10 bronchopulmonary segment. So that is about your bronchopulmonary segment. And as a physio, we need to have an idea, proper idea about it. So here we can see now, I'll just brush up the whole things what we had discussed today. So we had discussed about the lung. Okay, I mean, we had discussed about the bronchial tree, which starts from the trachea. After that, trachea divides into primary bronchi on left side and right side, which is bifurcated at the carina level. From there, you have secondary bronchi. From there, you have tertiary bronchi. The secondary bronchi is based on the number of lobes you have. So right side you have three secondary bronchi, left side you have two secondary bronchi. Now each side of the lung they have 10 segments, 10 bronchopulmonary segments. So this tertiary bronchi is present on each side in 10 number. Okay, so right side is also having 10 tertiary bronchi, left side is also having 10 tertiary bronchi. After that, the tertiary bronchi further divides into terminal bronchioles and respiratory bronchioles, and then you have your pulmonary unit. So the pulmonary unit consists of terminal bronchioles, respiratory bronchioles, then alveolar duct, alveolar sac, and then the alveoli. In that way, the whole thing is happening. Then you have this bronchopulmonary segment, the diagram of the bronchopulmonary segment where the gas exchange is happening. So this is also bronchopulmonary segment diagram. So this is one segment, adjacent segment is over here. Each segment has your pulmonary artery, which is carrying deoxygenated blood, and adjacent to bronchopulmonary segment, it is having pulmonary vein. Okay, branches of the pulmonary vein, which is there in the plane, intersegmental plane of uh, bronchopulmonary segment. So after going through the whole bronchopulmonary segment and bronchial tree, Now the time comes for the talking about clinical anatomy. So why we need to have an idea about the bronchopulmonary segment? Because if you see, if a patient is developing TB or if they are developing bronchogenic carcinoma, generally it involves uh, any of the bronchopulmonary segment. Okay, it is going to involve any of the bronchopulmonary segment. Now, just to show you here, I have put the video down. So that is why we need to have a proper idea about it. And through that, it can spread to the other bronchopulmonary segment also. If you'll go through the pathology, if you go through the pathology of the tuberculosis, TB infection, generally it starts from the right side middle lobe, in the medial or lateral segment, or else in the upper lobe, apical segment. So, as I told you, any of the bronchopulmonary segment is involved. Either it is TB or bronchogenic carcinoma. So that's why that knowledge need to be there. Second thing is why, as a physio, we need to have, or why as a pulmonologist they should have a proper idea about it, because segmental resection. Suppose if somebody is having apical lobe TB, which is having, now it's totally the apical segment or apical bronchopulmonary segment of the upper lobe has totally got damaged. It is not taking part in dissection, so it will be working as a रूम ओके इट्स नॉट वर्किंग इट्स एक खंडहर की तरह काम करेगा जहाँ पे कचरा जमा होता रहेगा एंड दैट कैन गिव राइज टू इन्फेक्शन सो इन दैट केस व्हाट द डॉक्टर्स विल डू दे विल रिमूव दैट पार्ट ओके थोरेसिक सर्जन जो होते हैं वो उसको रिमूव कर देते हैं दैट्स कॉल्ड अ सेगमेंटल रिसेक्शन या सेगमेंटेक्टमी सो दैट इज व्हाई we need to have a proper idea about the location of the segment. Okay, at the same time your veg resection is also done, but you need to have a proper idea कि कहाँ कहाँ पे हर एक चीज present होती है. दूसरी चीज, if they go for the bronchoscopy, so bronchoscopy is the procedure where they are inserting a, a probe, which is having camera to visualize the bronchi, to visualize whether they have any kind of infection or not, they have any kind of foreign particle or tumor growth. So for diagnostic purpose and treatment purpose, this bronchoscopy is used. So again, for that also, you need to have a proper idea about each of the segment. Then you have carina. As I told you, the carina is dividing your trachea in the primary and secondary bronchi, and that's why the location of the carina is very important, which is a hook-shaped and like as we had discussed earlier, that carina it is having a very important role because it is it is supplied with the vagus nerve, okay, which is a parasympathetic nerve. So they have a fibers from the parasympathetic fibers from the vagus nerve. If you are going inside with the suctioning or with the bronchoscopy, and if you are poking the carina again and again, this vagus nerve gets stimulated. And if it is getting stimulated, it can give rise to bradycardia, or even in severe cases, patient may develop cardiac arrest. So that is why we need to have an idea about carina. Okay, तो इसीलिए जब भी आप कोई ICU patient देख रहे हो, if you are going for the suctioning, you should not ignore the carina. Okay, you should not again and again poke on that area. Otherwise, life-threatening situation can happen. The another thing, as I told you about the unilateral intubation, which is happening because the right primary bronchi is quite straight compared to the left one. That's why if you are inserting the ET tube, endotracheal tube, it should be at the particular length. But without considering that length, if you're pushing it further inside the trachea, it can go into the right lung, right primary bronchi, and there it can cause only unilateral ventilation. Only the right lobe lung will get the ventilated air, and the left will not get. So left will develop the lung collapse. So that kind of unilateral intubation can give rise to this complication, where the left lung will get narrow, it will get collapse. So lung collapse situation can happen. Now, as a physio, this is the main part. Why we need to have an idea about the postural, about the bronchoscopy. So for the postural drainage. So postural drainage is this, these are the techniques of the postural drainage where you will study in exercise therapy part. So here we are using certain position where the gravity is helping you to drain the secretion. The secretion, the mucus which has got accumulated in the bronchopulmonary segment. So for that we require, we need to have proper idea about the bronchopulmonary segment. And by using that knowledge, you can apply this postural drainage technique. You can keep the patient in particular position so that you can drain the secretion from those area, from those segments. तो वो जो है वहाँ पे उस तरह से हेल्प करेंगे. So that's why we need to have proper idea about it. Then bronchial asthma is another applied anatomy which is happening in the smooth muscle area, which is from area number, from the in the respiratory zone. The smooth muscle, they get constricted, and bronchoconstriction happens, and that can give rise to increased resistance to the airflow, and that's why patient with asthma, they develop this kind of pathology. The another thing is lower lobe in your both side, lower lobe, the apicobasal segment or superior segment or apical segment. Okay, it is mostly in the dependent position. So if you lie down in the supine position, it will be more among all the bronchopulmonary segment, this one, the apicobasal segment, is the most dependent segment. That is why any kind of foreign particle tend to get dislodged into that particular segment, and that's why pneumonia can happen over there. If the patient is bedridden for longer period of time, they will develop pneumonia in that area. So there also the role of physiotherapy play a major role to prevent this kind of complication. So they were the few of complication or clinical anatomy what we had discussed. Even few more like paradoxical respiration. So anytime normally when you inhale, the chest wall need to expand. When you exhale, it need to get constricted. It need to come back to the original position. But if it happens in a reverse pattern, that with inspiration it is getting narrow and with expiration it is getting expanded, that shows it's called as paradoxical breathing pattern. So that can happen. Okay, so today we talked about the bronchial and bronchopulmonary segment. I hope that you had uh, you got clear with this topic. Okay, uh, so if you find any doubt, kindly do let me know, do comment, do ask me the question. Okay, we can still discuss about it. We can keep one another special video for doubt clearing, and kindly like, subscribe my channel. Okay, so that can help me to grow this channel in a better way, and even I can deliver the knowledge what I had been learned. I can deliver it to the next generation of physiotherapists. Okay, so thanks a lot, and all the best.